Tick-tock on the masks, huh? Weather warming up. Oh, my goodness. Have you seen the forecast, by the way? Holy goodness. I'm looking at it right now as we look at the end of the week here. 26 tomorrow. Sunny, by the way. Sun. 29 Thursday. 30 Friday. 30 Saturday. So it's hot. And then on Saturday, you get a mix of sun and cloud. And you get the sun, and you get 30 degrees. And you also get this. Mask restriction. Gone. It's May 14th. Masks will no longer be required in indoor spaces in this province. Of course, there are some exceptions like public transit and the healthcare space, but the masks, they go on the 14th of May. So should we ditch the mask when we're allowed to on Saturday? Dr. Christopher Labos is on the line. You hear him on Sunday mornings on CJAD 800, on his Sunday morning house call on Weekends with Ken, 8:10 a.m., by the way, on Sundays. And he's now with us. Hi, Dr. Labos. Welcome back.
Thank you, sir.
So, it is Tuesday, May 10th. Saturday, May 14th, right? That's when we're ditching the mask. What are you doing? Are you ditching the mask on May 14th?
No, I'm going to be keeping it with me. Now, that being said, I do spend most of my time in healthcare facilities, clinics, seeing patients, and so that mask is going to remain. I think we are going to look back historically at the idea that we allowed people to visit hospitals and walk around and see patients without any type of personal protective equipment, with the same type of incredulity that we look at old hockey games and see people not wearing helmets. So I think in the healthcare setting it's going to stay, and it's probably going to stick around forever, quite frankly.
Okay.
So I'm going to be keeping the mask. Frankly, it costs me nothing to wear it. If you're going to be indoors with a bunch of other people in a crowded space, it gives you, again, we have other things beyond COVID that are still circulating. We're having resurgence of the flu now. So, if you want to avoid getting sick, the mask makes a difference. And I think most people have realized most people didn't get colds over the 2 years of the pandemic because they were wearing masks and, keeping a little bit of a distance from other people. So doing that is going to make a huge difference going forward. And I think you're going to see this country really come more in line with a lot of other countries like Japan do, which is if you're going to be on the bus or the subway and, a bunch of other people, especially during cold and flu season, you wear a mask. I think it makes a difference.
So, Dr. Labos, I know someone who just came down with COVID, and they're pretty sure they got it when they had to go into the hospital. So I could totally see where you're coming from in the healthcare sector. Obviously, public transit's going to stick around, but it's gone. You go to a concert, it's gone, right? If you go to the Bell Center, it's gone. You go to the Corona Theater, it's gone, right? You go to the MTELUS for a show, it's no longer there. What would you do in those situations? Are you going to be still wearing your mask?
Yeah, it depends on the context. Depends if it's an indoor or outdoor event. Obviously, that makes a huge difference. It depends to a certain degree of how much COVID is circulating in the community, right? If there's very little COVID circulating, the mask becomes less important. If there's a lot of COVID circulating in the community, the mask becomes more important. The problem we have now is we don't have a good sense of how much COVID is circulating in the community because we don't have access to the wastewater data. We're not testing broadly for COVID anymore. So when you ask people to make these sort of personal risk assessments, it's like, well, in the absence of data, are you going to err on the side of caution or not? So that's the very difficult calculation that people have to make. Honestly, in most situations, like if I'm going to the grocery store and stuff, I have it with me. It's in my car. I'm just going to put it on. It frankly costs me nothing to do it. So I fall under the category of, why not? There's no downside to it.
All right, Dr. Labos, I want to move this along here and talk about the story of hepatitis showing up in children around the world. The CDC in the U.S., they're investigating 109 reported cases of unusual hepatitis in previously healthy young children, 14 of whom needed liver transplants, 5 of whom have died. What do you know about this story?
So we don't know a lot because we don't really know what's causing it. Most cases of hepatitis are either due to alcohol abuse or from viral hepatitis, right? Hepatitis A, B, or C. Because of the age of children, we can be pretty sure it's not chronic alcohol abuse. And they tested for viral hepatitis, and that doesn't seem to be the cause. So it's unclear what's actually causing this. What we can say for sure is that it's not the COVID vaccine, as some people have liked to claim online, because a lot of the children who are getting sick were under the age of 5, and obviously they haven't been vaccinated, so it's not that. The leading contender seems to be an adenovirus, which was detected in some but not all the cases. So it's possible that this adenovirus infection is what's causing the inflammation of the liver and making these kids so sick. But that, this remains to be seen. There's still a lot of unanswered questions, and there's no clear single cause at this point that we can really put our fingers on. So still a lot of unknowns there.
You said an adenovirus. Can you tell me what that is? More about that?
Yeah, so an adenovirus is a strain of virus. It usually just causes mild cold-like symptoms, but this one, if it does turn out to be the culprit, is causing a more severe infection in these children. And again, other viruses can cause liver inflammation, right? So you can have things like cytomegalovirus can cause inflammation in the liver. So there's other types of viruses that can do it. Adenoviruses don't typically do it, but when they've looked at, especially in the UK, when they've looked at all the cases that they have had, a fairly large proportion of the children had this type of adenovirus infection prior. So the leading contender for a cause is that it's this type of virus that is causing inflammation in the liver in these young kids.
Okay, so there could be another virus, this is not related to long COVID either, under this scenario, right? This is a separate virus, you're saying.
So the most likely is that it's a separate virus. Now, you can't completely exclude COVID, and there's always been some debate about, well, since you can't attribute it solely to adenovirus or solely to COVID, could the two be playing on each other? Huh. Don't forget, there was the MIS-C condition, right, this multi-system inflammatory condition that happened in young kids who got COVID infections. So there is a theory that perhaps this type of problem coupled with an adenovirus infection is what's triggering it. But a lot of this is still speculation. So it's not, there's no proof that it's COVID related yet, but it hasn't been definitively excluded. And maybe it's a contributory, if not the causative factor.
And just to put it in perspective here, we are still talking about a small number.
Right, yeah. You're talking about, 100 or so cases in the U.S., 100 or so cases in the U.K., smaller numbers in other countries. It's definitely more. There's definitely more than what you would normally expect because children do get hepatitis, but this is more than that. This is more than expected. So clearly something has changed, but it's still relatively rare, when you look at the absolute numbers of cases. But it's still important to look at because you want to make sure that it's not something that could be easily treated. Because, again, 5 children dying, yes, it's a small number, but it is still 5 children who have died. So it's worth looking into and worth sort of solving this medical mystery.
Dr. Christopher Labos is a cardiologist with a degree in epidemiology, and you can hear him, of course, for his Sunday morning house call at 8:10 a.m. on Weekends with Ken on Sundays. Dr. Labos, you take care.
You take care, too.